Good afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So, now I'm going to tell you about ischemic heart disease. So, the group of related syndrome, ischemic heart disease is a generic designation for group of related syndrome resulting from myocardial ischemia, an imbalance between cardiac blood supply and myocardial oxygen demand. It can result from increased demand or diminished oxygen carrying capacity. It is due to reduction in coronary blood flow caused by obstructive atherosclerosis disease in majority of the cases, also known as coronary artery disease, and the clinical manifestations are direct consequence of insufficient blood supply to the heart. So there are four basis clinical syndrome: angina pectoris, myocardial infarction, chronic IHT, and sudden cardiac death. So vascular anatomy is endothelium is a barrier between blood and arterial wall. There are basically three layers: tunica intima, media, and adventitia. So atherosclerosis, in this there is hardening of vessels due to calcium deposits in tunica intima and gradual loss of lumen of arteries and ventricles because hypertrophied as a result of extra force required to push the blood through narrowed vessel. So which can lead to platelet entrapment or then again thrombosis. So this in this figure one can see this here, the plaque formation. So clinical pathological correlation, like there could be stable angina, means there is fixed atheromatous stenosis of one more coronary arteries. And unstable may be dynamic obstruction in the coronary artery due to plaque rupture. Then infarction by acute occlusion of coronary artery. Heart failure, myocardial dysfunction due to infarction or ischemia. Then arrhythmia, it could be altered conduction due to ischemia or infarction. Then sudden death. Ventricular arrhythmia, systole, and massive myocardial infarction. So there could be pain, dyspnea, alteration in skin color, calmness and sweating, decreased BP, or there could be altered pulse, pyrexia, there could be edema, contractile dysfunction. Other complications are arrhythmias, myocardial rupture, pericarditis, infarct expansion. Then it could be papillary muscle dysfunction or progressive late heart. So, in athletes above the age of 35, especially in men, the most common cause is atherosclerotic coronary artery disease, and in young, it is less common. Other can prominate, like these are in this table. One can see the causes of sudden cardiac death in young athletes. So, 46% is due to hypertrophic cardiomyopathy or unexplained left ventricular hypertrophy, and 19% is due to coronary arteries anomaly, then myocarditis or any other uh, we can say condition. So what are the contraindications to high intensity sports are left ventricular ejection less than 50%, tachyarrhythmias, hypotension, exercise ischemia, syncope, there could be valvular disease or prior embolic event. So these symptoms may indicate any heart failure like shortness of breath, this unexpected drop in performance, dyspnea, persistent fatigue, mental disorder, dizziness, persistent cough, then nocturia, lower extremity swelling, anginal pain, any recent respiratory tract infection, or heartbeat irregularities. So these are the references. Thank you.